Hernandez, the Tribal Early Learning Fund Specialist with the Office of Tribal Relations, along with Chanel Squally Jansen, the Tribal Prevention Specialist, also with the Office of Tribal Relations, and our chat manager. It is our pleasure to welcome you to What's Kinship Care and Why Is It Important to Tribal Children? At this time, we'd like to introduce Mandy Moreland, the Tribal Foster Care Licensing Consultant for DCYF and the Office of Tribal Relations, Renata Watson, Kinship and Foster Care Licensing Partnership and Support Manager for DCYF in Region 3. For this session, our chat manager will be collecting your questions for the Q&A at the end. So please hold on to those. And presenters, please let us know when you're ready.
I think we're ready. Hi, I'm Renata Watson. So pleased to be here today.
And good afternoon, I'm Mandy Moreland, and I am also pleased to be here.
And we will be talking about what's kinship care and why is it so important to tribal children. So we will go through the agenda, that there are important changes coming to kinship licensing in Washington State, which will have an impact for tribes, tribal children, and kinship caregivers. And today you'll learn what's happening, why it's important, and how it impacts tribal partners in particular. So we will cover tribal sovereignty, boarding schools, and forced assimilation, the Indian Child Welfare Act, shifts in kinship care, the creation of new licensing kinship standards, and the process or the progress on our kinship goals, and have some time for any additional questions. I do know that you were just asked to save your questions and put them in the chat. But I believe Mandy and I are both open to having an actual conversation during this. And if you have a question, please feel free to raise your hand or put it in the chat. And then if the chat manager just wants to let us know that there's a question for us to address, because it's hard to share a screen and present and look at the chat at the same time. But we do want to answer those questions in real time. Now I will hand it over to Mandy.
Thank you, Renata. And so when talking about kinship care, it's really important that we acknowledge our tribal partners. And in doing that, we would like to reinforce the understanding of sovereignty. And for some of our DCYF staff, this is still a learning process in how we work with tribes, and sovereignty is the foundation of our work with tribal partners. It's the understanding that tribes are a sovereign nation that are essentially a supreme power, especially over a group of people who are politically organized under a government authority, and they are free from external control. So they develop their own laws and their own codes. They have their own cultures and customs, and every tribe is different. Next slide, please. And so in understanding tribal sovereignty, it's the right of American Indians and Alaska Natives to govern themselves. And the U.S. Constitution recognizes that they are a distinct government with the same powers as federal and state governments to regulate their own internal affairs. So you can see in this diagram, this is the reflective of the equal powers of a tribal government and a state government. And they are the oldest sovereign nations. The tribal governments are the oldest sovereign nations on the continent and predate the sovereignty of the United States. And they're responsible, like I had said before, for providing their own basic needs of their citizens, the same as states, and can access the same resources through DCYF as Washington State citizens. So they do build their own infrastructure and they maintain that. They conduct their own business laws and criminal lawmaking. They license and monitor compliance with their laws. They engage citizens in their elections, and they provide for the needs of their people through education, nutrition, medical care, mental health. And then they create enough revenue to support and sustain that infrastructure. Next slide. And so sovereignty is important to understand because it constitutes a legal and political status and acknowledges the right of tribes to self-govern. It means that tribes have rules and customs and cultures and protocols, and that all tribes are different in these customs and cultures and protocols. And tribal governments are distinct, independent entities with that unique authority. They're set apart from all other ethnic and racial groups. So tribes are not stakeholders, they are our partners, and they are required to be consulted by DCYF on any organizational change that impacts them. And there's a link to the tribal consultation policy in here as well that reflects that partnership. So honoring sovereignty is important because traditionally Native Americans have cared for their children through extended family and community since time immemorial. And DCYF's shift to kin first culture is really modeled after how tribes have operated. So DCYF continues to learn from tribes and their kinship care programs and how they support their relatives' placements. And so it really is, DCYF is really modeling after how tribes have always functioned. And it's the sovereign right of tribes to determine their kin regardless of familial connections. And this is not anything that should be questioned by DCYF. So tribes determine who their kin are, who relatives are within their community, as they have always done.
So kinship care is normal. Most children not living with parents live with kin, either informal, outside of the foster care system, or formal, versus community foster care. In fact, the foster care system is the only system that sort of considers kinship care not to be normal and not the normal state of being when a child can't be placed with their parents. Children do better when placed with kin across every measured health factor. There are both national statistics and Washington state statistics to prove that fact. And so kinship care rather than community foster care really aligns most closely with natural family structures. It is in alignment with our ICWA laws, and Washington historically has inequitably placed with kin. We have placed with kinship caregivers, but we have been biased specifically against tribal kin. It's been very difficult for Native children to be placed with their kin. But just a reminder that for every one child raised by kin in foster care, there are at least 10 out in the wild without DCYF involvement being raised by their kin.
So boarding schools and forced assimilation has had a very strong impact on tribes and tribal communities and tribal people. And it's important that we understand, we understand the foundation of sovereignty, but we also understand how sovereignty has been violated at the hands of the government. And so, for all our tribal folks in here, in this group together, they understand, how this impacted us deeply. Our ancestors and our relatives being sent to boarding schools, and this really does shape the relationship that tribal people have with DCYF because of that sovereignty violation by the being forced to go into boarding schools. As we know, it was very militaristic viewpoint for children being removed from their family and being sent to boarding schools. And they were exposed essentially to cultural genocide, not being able to speak their languages, to learn and practice their customs and their culture. And it really was very impactful on, and still continues to be impactful today on how tribal families work with DCYF. There is an inherent distrust from Native communities to work with DCYF and to work with states and the government because of the fact that the impact that boarding schools has had on tribal communities. And so really, this shift to kinship care, we're really hoping that it supports our tribal families, our tribal communities, and recognizing that we have learned from tribes, and we are wanting to do it better, and support tribes and their children in their community, and also becoming licensed and receiving the same support and financial support and wraparound support that DCYF children and families receive. Next slide. And so Renata touched a little bit on the Indian Child Welfare Act, and that it does set the federal requirements that apply to child custody proceedings involving Indian children. And it exemplifies the gold standard in child welfare because of its placement preferences and other provisions of work that really maintain and strengthen a child's ties to their family, extended family, and culture and community. So kinship caregivers rarely have the chance to prepare for place. Or is this your slide, Renata?
Yeah, sorry, I just couldn't figure out how to unmute while I was screen sharing.
Okay.
So there are special challenges faced by kinship caregivers with a traditional or community foster caregiver who are very important. I don't want you to think that we're saying that having community foster parents are not important. We need those people, but they have months or even years to make this choice to open their home for children. With kinship caregivers, they don't have that opportunity. Often they're getting a call in the middle of the night and they have no chance to prepare for the placement. However, we know that kinship caregivers are safe for children, and we as a department have approved them as safe place for both placement and permanency through what we call the unlicensed home study, which means that we had a way to approve them and say that they were safe, but not give them the license, which was difficult to get since they did not have the time to prepare. So kinship caregivers were not being financially reimbursed for the safe care that they were providing for their kinship children, which means that we had created a system of inequity between those folks that had time to prepare and plan and those family members who did not have time to prepare and plan and still are considered safer and healthier for children. So we've recognized that there's a system of inequity where we're really financially supporting children when they're not placed in the best placements possible.
Renata, we have a question.
Oops, go ahead.
We have a question from Mary.
Sorry, Mary. Go ahead, Mary.
Sorry, I don't know why sometimes it does that. I'm so sorry.
Oh, okay. Thank you.
So there was some new or reclarified guidance through 1227, which was a House Bill 1227, Keeping Families Together Act, where it really clarified that we will be placing with kin as long as the kinship caregiver is interested and able to meet the needs of the child, willing to follow the court orders and support visitation and reunification, and otherwise able to provide competent care, we will be placing children with their kin. Even if the kinship caregiver has an incomplete background check, is uncertain regarding permanency, does not believe that the parent did anything wrong, as long as they're going to follow those court orders, they don't have to agree with us. And even if the home is not sufficient to satisfy the requirements for licensed foster homes, again, our courts will be placing children with their kin because there's such extensive research that children do better when placed with kin. And the court may and will order the department to provide financial supports necessary to ensure safe conditions in the home and a support plan to address any safety concerns. partially because of what's happened in Washington, but also what's happened nationally and with tribes, and research that includes impacted groups and kinship caregivers. The federal rules have actually changed. And I just want to give a nod to many of the tribes in Washington state who participated in research and supported the federal rule changes. So the federal vision is to make it easier for kinship caregivers to become licensed. And we want to create a kin-specific license that allows the license to be tailored to the needs of that specific child with the focus on the safety rules relevant to that child. So for a community foster home, we don't know what child is going to come into that house. So we need to set the standards of safety to cover any child that might be placed in that home. Whereas with a kinship placement, we know exactly what child is being placed. We understand those behaviors and we can tailor the needs of that license to that child. In Washington, we have a goal to license at least 80% of our kinship caregivers, including caregivers of tribally dependent or children tribal children in DCYF custody. For tribes that utilize DCYF for licensing homes, we have a route for them as well, and we want to license homes for them as well. And I see that there was a question in the chat about kinship. So the rules that we are proposing for the kin-specific license is to include relatives, suitable others who are considered like family friends, the auntie and uncle, neighbors, best friends, parents, and kin as defined by the tribe. So each tribe will define kin for their own tribal children. So there are many different types of care. I'm just going to go through the columns starting from left to right. So the first type of care is that sort of inequitable care that we have already talked about, where children are being placed with kinship caregivers with no financial support through the licensure process. One of the things that Washington created last year and went into effect October of last year, actually, so we've had them around for 1 year now, is this initial kinship license. And that is a very temporary short-term license, 90 days maximum, which I like to think of as like the driving permit of foster care licenses, where based on the fact that the child has been placed, we will issue a 90-day temporary license to provide financial support while to allow a family to go through the full licensing process and get support through that process. We have our current kinship license, which is a child-specific license, but that is based on our current community foster home WACs and our current home study that is used for both community and kinship caregivers. We are able to waive some non-safety rules to make it easier to license kin, but it is still sort of fitting that square peg into a round hole of trying to get kinship families to fit into the model that was created for community foster homes. So because of the new federal guidelines, we are creating our new kinship license, which will have a new streamlined home study, simpler application and licensing process, and a completely different chapter of law, Washington Administrative Code, specific to the kinship license. And then we, of course, will keep our community or general foster care licenses, although that is also going through some negotiated rulemaking changes, and there will be some separate changes coming to community, foster homes in 2026. So as we are creating our new WACs, our Kinship WAC chapter, we have been trying very hard to make sure that we are including all impacted groups, tribal partners, and kinship caregivers as well. On the left-hand side, you can see the different groups that we've interacted with. Washington State was very heavily included in those national standards created by groups outside of the department. So the national standard recommendations included specific guidance from Washington State kinship caregivers, community groups, tribes, Office of Tribal Relations, tribal and non-tribal child placing agencies, and DCYF staff. Based on those national standards, the Office of Tribal Relations, tribal and non-tribal child placing agencies, and DCYF took a first attempt at drafting WAC chapters of the WAC chapter based on the national standards. It was open for community feedback this last summer, and we again made sure to include the voices of all of the groups listed on the left. We are in the process, or we completed our revision based on the community feedback and are participating in tribal roundtables. We had our first last week and we have our second one next week to make sure that we are including tribal voice and that government to government respectful relationship when we are creating these new rules. These new rules will be filed in December of this year and will be open for public review. So you're all welcome to look for those in December and provide feedback on those rules. And we are planning to go live with our new kinship license, including our new home study, policies and procedures this coming summer of 2025.
Can I drop in the
So-
chat for our tribal partners? Sorry, Renata. If you are interested in attending the roundtable discussion to discuss the new kinship care WACs, we have a meeting coming up on October 22nd from 10 a.m. to noon. You can email me and I can forward you that invite so that you can review the kinship WACs and provide input from the tribal perspective to make sure that they are culturally appropriate in serving tribal children and communities and families. So please let me know if that's something you're interested in. I'd be happy to get you the invite so that you can participate in this discussion along with other tribes in Washington.
There was also a question in the chat. Is placement with licensed kin included in the definition of out-of-home placement?
Yes, when we talk about out-of-home placement, we're talking about children taken from their family of origin. So, and I'm wondering which slide I was on when that question came up. So if you have clarification on that question, I'm happy to answer further. No? Okay. So we're actually in Washington State, we have made such amazing strides in unlocking financial support for children placed in kinship care in Washington State. In 2019, only about 12% of our kinship caregivers were receiving foster care reimbursement for providing that safe care for the children in their homes. As of July of 2024, 62% of our kinship families had a full kinship license. An additional 9% were receiving that initial temporary 90-day license, leaving only 29% of our families and about 28% of our children in kinship care without that financial support. We have also created a pathway for children who are under tribal jurisdiction for their kinship caregivers to receive initial and kinship licenses through DCYF, should the tribes request that. So as of July, we had issued 4 initial licenses only. We had issued a total of 11 fully licensed or full kinship licenses, which included the initial license support. And then we have an additional number working towards a kinship license without that support of the initial license. So they're not incredibly high numbers, but and I think I may have described that wrong. So 15 caregivers were currently receiving foster care payments. 7 were working towards that full kinship license, and 4 received the initial license only and did not complete the kinship license, which is anyone can choose to do that. So tribes who are interested in seeking initial or kinship licenses for their kinship caregivers through DCYF, we do have a process developed for that. And again, you can reach out to Mandy if you want additional information on how to access that resource for your kinship caregivers.
There's another question in the chat here from Stan. It says, if I get a kinship certification in Washington state, does that carry over to Alaska if it is federal or only state certification?
So each state or 4E agency has their own licensing process. So you cannot carry a license over to Alaska, but Alaska may have kinship licensing standards of their own. Many of the states and several tribes are creating their own kinship licensing standards. And in fact, I can't remember which tribe it was. Mandy, do you remember? One of the tribes
Port
was
Gamble. Port
Yeah.
Gamble is developing their own kinship licensing standards as an intergovernmental agreement. And so there are tribes who have intergovernmental agreements with DCYF to create their own licensing standards in accordance with the national guidelines. So that is also something, if you are interested in discussing more, please do reach out to me. And I'd be happy to coordinate a meeting to discuss the pathway to becoming what we call an IGA tribe, an intergovernmental agreement tribe. And we also wanted to open the floor to additional questions, or if you had questions about the different types of licenses for your caregivers, we can answer and have a conversation around that as well for our tribal partners in the room.
There's a question in the chat. It's a long one. You guys can take a look at that if you want.
Yeah. So I'm going to stop sharing so I can see people's faces a little bit better and read the chat better. So it says, what is the state's responsibility to ensure Native children in out of home are connected to cultural events and activities, especially Native children in non-Native foster homes? I'd recommend OTR should have a dedicated staff to ensure cultural connections for Native children in out of home care. I've had terrible cooperation with the state in this regard, meaning many Native children are not allowed to be offered cultural opportunities. Well, I'm really sorry to hear that feedback. If you are ever struggling with a particular case, please do reach out to Mandy to get her involved. And what I will say is that we are trying to strengthen the WAC for both community foster care and kinship care to include the requirement to allow children to participate in cultural events. And Mandy, I don't know if you have more to add to that.
Yes, so some of you may have heard about the new Caregiver Supports Program. And so that is a program that is, again, modeled after how tribes have operated, since time immemorial. It is essentially a wraparound service program for caregivers to provide support to caregivers, because when caregivers feel supported, they're better able to support the children in their care. And so that is a new program that is launching and is also being offered to tribes to essentially get paid for what they've been doing since time immemorial, supporting their caregivers on a very high level, meeting their caregivers where they're at with the support. And within the caregiver support program, there are contracted providers that are required to provide support to every caregiver for DCYF. So tribes will have the option of opting in to the caregiver support program and entering into their own agreement, or completely opting out and continue maintaining the support services that they have and they've been executing successfully. And so within the caregiver support program, there are certain domains that the caregiver and the caregiver support specialist work together to ensure the child is meeting. And one of those domains is their cultural connections. So that is something that is now being required in a slow rollout. So it's started to roll out already, but it will be fully implemented across the state in 2026. And that is a requirement to assess and to support children being connected to their cultural community traditions, and partnering with the tribe and what that looks like for support for that child and for that caregiver. Because oftentimes when children are placed in non-native homes don't know where to turn to find that support. So the role of the caregiver support specialist is to be that liaison, to collaborate with the tribe to ensure that that child placed in that home knows how to get the support, knows how to be involved, knows who to connect with, to attend powwows and to be involved in any ceremonies, or to connect them with relatives that can bring them back to their community. So that is a newer program. There is a website link that I can drop in the chat that explains the caregiver support program and also the tribal engagement piece with the caregiver support program. We'll be having roundtables for that program as well coming up. The first one being October 30th. And then on November 7th, because we want to talk with tribes specifically on how we can model this program to support tribes' right to self-govern, and to also provide that financial support to tribes for doing what they've always done, providing support to their caregivers. But now we want to really support them financially and continuing to bolster that support that they're offering to their caregivers. So that is also a new kind of concept that DCYF is leaning into, again, modeled after how tribes have always functioned. And it's really, evolving along with the kinship care. So it's a really well-timed project and is really in support of kinship care as well.
Mandy, one of the questions in the chat said, would you suggest a case be lick-whacked? Can you explain what that is and answer that?
Yes. So for lick-whack purposes, I don't know if we have any of our ICW consultants in the room, but so every region has an ICW consultant, and they work primarily with the child welfare cases. So that is, and then we also have a lick-whack coordinator here at the Office of Tribal Relations. And so in conjunction with the ICW consultant and the lick-whack coordinator, cases can be lick-whacked if it's determined that there is a need to be lick-whacked. And so that would be, if a question, if a recommendation came to me about making a recommendation for lick-whack, I would connect you with your ICW consultant as well as the lick-whack coordinator, so that they can work to determine the best next steps for that family or that child.
There was also a question right above that says, from Anthony White, would this also include fictive kin, a person that is not related, but has an appropriate connection to the child or family?
So if we're talking about for the kinship standards, yes, the definition for a kinship caregiver includes relatives, we call them suitable others, but other people call them fictive kin, and also whoever the tribe identifies as a kinship caregiver. And then the kinship care through the licensure, they are receiving the exact same amount of funds as a community foster parent. So anybody who holds a license, whether it be a kinship license or a community license, would be reimbursed in the same way for taking care of the same child. Now, if you do not get a license, there's no license reimbursement associated with that. So we do still have kinship caregivers who are not receiving financial reimbursement for caring for the children. They may be receiving like TANF, or going through some tribes have their own ways to support kinship caregivers, so that they may be receiving some form of financial reimbursement, but they're not receiving that licensing reimbursement.
There's another question from Lisa Powers. When was the decision made that some cases do not need to be LICWAC? It used to be every case.
So LICWAC is not my area of expertise. I specialize in foster care. But I do see that Elsie Cruz is here. Elsie, is that something you could speak to?
Yeah, I think I would need more context, but I think part of the piece of why cases need to be LICWAC, we would only LICWAC a case in where we don't have an identified tribe that is engaging in the case, or we're not able to get a response. But otherwise, any case in where there is reason to believe that there is Native affiliation should be LICWAC'd.
Thank you, Elsie. I appreciate you allowing me to put you on the spot. I also wanted to make note that Gabriel Sanez dropped in some information on LICWAC meetings for CFWS cases farther up in the chat at about 2:39. So there's some more information on LICWAC there as well.
And if I could just hop in, I'm the Region 4 Tribal Liaison ICWA consultant, and I'm the one that facilitates LICWAC meetings here in the Seattle area. And this is just a piece of the policy that I've put into the chat.
Thank you, Gabby, and thank you, Elsie. I appreciate it. Are there any other questions or areas of support that tribal partners wanted to talk about? Okay, well, with that, it looks like we will, oh, is there any initial screening for a kinship provider? Renata, I'll defer to you for that.
Yeah, so when child welfare is making a placement, they are required to do to start the background checks, get the family conditionally cleared, and do a walkthrough of the home. So those are the placement requirements. Additionally, they should be having the caregiver read the child's chipper, their child health information, so they kind of know what they're getting into, and sign a placement agreement where they're agreeing to meeting the child's needs and supporting visitation and reunification, all that jazz. So that is sort of the placement requirements. So that's that initial screening. And then once the child has remained in a home for about 10 days, the licensing division is getting an automatic notification. And these are for children who are placed in the care and custody of DCYF. We get an automatic notification reach out to the family to offer them that initial license and start working with them through the licensing process. For caregivers of children in tribes care and custody, the tribe has to make that referral to DCYF, so we know to reach out to the family to offer them those licensing supports. And I see a couple of questions. So let's start with, is the state welfare agency always involved if the tribe is the governing body? And Mandy, I think you can answer that question better than me. I can answer it, but not as eloquently.
Yep, I'll take it. So, so no, the state is not involved if children are under the care and custody of a tribe. And every tribe has their own codes and laws to determine when they take jurisdiction of their children. So some tribes will file immediately if the child resides on the reservation. Some tribes will intervene when DCYF does an investigation, or if DCYF decides to file on that child, then the tribe will intervene and take jurisdiction. And when a tribe takes jurisdiction of their children, the state has no involvement in those cases. The only involvement that the state would have in a tribal jurisdiction case is if the tribe requests services for that child or the caregiver. And that is essentially just a partnership where the state will provide funding and support to support that child and the caregiver for placement stabilization purposes, or for the biological parents for case plan requirements. And so that is called tribal payment only, where the tribe requests the state to open a tribal payment only case for a tribal jurisdiction child to essentially just provide payment for that child, caregiver, and biological parents for the purpose of reunification. And there's also other supports that can continue on if reunification isn't the final plan through that tribal payment only case, such as guardianship assistance payments, adoption support, extended foster care. And so essentially tribes can access all of the same services that DCYF families can access. And so their method of accessing those is by opening a tribal payment only case, and then they can receive all of the same supports and services. But the state has no oversight on those cases. The tribe handles them completely under their sovereign authority.
And then there was another question in the chat about if we are a community licensed caregiver, how can we be recognized as a kinship placement by the state? Would it be by an individual tribe? We are Alaskan Native household with frequent Alaskan Native placements. Excuse me, kinship designation seems to offer more weight when advocating for a child. And, we do have community foster homes who take in kinship placements and can be identified as kin. But yes, it would be that tribe identifying you as a kinship placement rather than a community foster placement.
We have about 4 more minutes left if there's any more questions, but I wanted to go back to something Rebecca Hightower said at the beginning. She said, this would have been a great presentation for our Olympic Peninsula ICWA conference yesterday, maybe next year, an updated version.
Oh, I think Mandy and I would both be honored to present anywhere that you would want us to present. So thank you very much.
Thank you, Chanel, for that. So please thank Mandy and Renata for sharing with us today. Are there any final last questions?
And if something comes up later that you forgot to ask, or if it just comes to you after this meeting, please feel free to reach out. We're happy to partner with all of our tribes and to support our DCYF staff in the shift to kinship care and kin first culture. So please let us know if you do have any questions that come up after we exit.
And their contact information is in the chat link. We now have a short break and we'll come back together around 3:10